Welcome back to Beyond the Vet Visit. In part 1 of our Parasite series, we talked about some of the most common intestinal parasites we see in dogs and cats, including roundworms, hookworms, whipworms, and tapeworms. But those aren't the only parasites that veterinarians diagnose. Today, we're going to talk about 2 microscopic parasites that are a little different: Coccidia and Giardia. We'll also discuss one of the biggest questions that pet owners have: can my pet's parasites affect my family? And finally, we'll talk about treatment, prevention, and what you can do to reduce the risk of parasite problems in your pets. I'm Dr. Matt Clark with Class and View Veterinary Clinic, and this is Beyond the Vet Visit. Before we get started, I want to remind you that this video is intended for educational purposes only. Every pet is different, and the information discussed here should not be considered a diagnosis or substitute for professional veterinary care. If your pet is experiencing severe diarrhea, vomiting, weakness, weight loss, dehydration, bloody stool, or any other concerning symptoms, please contact your veterinarian for advice specific to your pet. The goal of this channel is to help you better understand veterinary medicine so you can have informed conversations with your veterinarian and feel more confident caring for your pet. So, let's start with Coccidia. When most people hear the word parasite, they immediately picture something like a roundworm or tapeworm. But parasites come in many different forms. Coccidia are microscopic, single-cell parasites that live in the intestinal tract. The most common Coccidia that we worry about in dogs and cats belongs to a group called Cystoisospora. Because they're microscopic, you won't see Coccidia with the naked eye. They're usually identified through fecal testing. Pets become infected by swallowing the microscopic parasite stages called oocysts from the environment. These oocysts are passed in the stool of infected animals and can contaminate areas where pets spend time. A puppy playing in a contaminated yard, a kitten exposed to contaminated bedding, or a pet licking contaminated material from their paws can potentially become infected. Young animals are especially vulnerable because their immune systems are still developing, and they're more likely to have exposure in their environments with other animals. This is one reason that Coccidia is commonly seen in puppies and kittens, shelters, breeding facilities, and other situations where many animals are housed together. Many adult dogs and cats may have mild infections or no obvious signs at all. However, in puppies and kittens, Coccidia can cause more noticeable GI problems. The most common sign is diarrhea, but other possible signs include decreased appetite, vomiting, dehydration, low energy, and poor weight gain. Young animals can become dehydrated very quickly, so persistent diarrhea in a puppy or kitten should always be taken seriously. In fact, one of my own dogs was an owner surrender because he was so sick from Coccidia they didn't want to treat him and wanted to euthanize him. They decided to sign him over to the clinic. They went to, and he was able to be treated, and now he's 15 years old and still going strong. Coccidia are important though because they're commonly a cause of diarrhea, especially in young animals. However, it is important to understand that Coccidia on a test doesn't always mean that it's the only reason a pet is sick. In fact, if your pet eats rabbit droppings, it might be a false positive because their Coccidia is different than the type that cats and dogs get. Some animals can carry small numbers of Coccidia without having any disease. Your veterinarian will look at the whole picture, including your pet's age, symptom, health status, and test results when determining whether or not to treat. Another challenge with Coccidia is that the parasite stages can survive in the environment. This means cleaning and sanitation are very important in reducing exposure, especially in areas where multiple pets are present. The good news is that Coccidia is a parasite that we're really familiar with managing. With appropriate treatment, when needed, good hygiene, and supportive care, most pets recover well. Now, let's talk about another microscopic parasite that many pet owners have heard of: Giardia. Giardia is one of the parasites that tend to create the most questions and confusion for pet owners. Unlike roundworms, hookworms, whipworms, and tapeworms, Giardia is also not a worm like Coccidia. It's a microscopic, single-cell parasite that lives in the intestinal tract. Giardia affects many different species, including dogs, cats, and people. However, one of the most important things to understand is that finding Giardia does not always mean that the pet is sick. Some animals can have Giardia without showing any signs at all. Pets become infected by swallowing microscopic Giardia cysts from the environment. These cysts are the form of the parasite that allows them to survive outside the body. A pet can become exposed through contaminated water, food, infected stool, or surfaces where an infected animal has been. This is why Giardia is sometimes associated with things like drinking from puddles, streams, or other water sources. It can also spread in places where many animals share environments, like shelters, kennels, dog parks, or daycare facilities. Once swallowed, the parasite moves into the intestines, where it multiplies and can potentially cause intestinal issues. Many pets with Giardia don't show any obvious signs. When symptoms do occur, they're usually related to the gastrointestinal tract. Common signs might include diarrhea, soft or poorly formed stool, increased stool frequency, mucus, weight loss in some cases, decreased appetite, or decreased energy. One thing owners often notice when Giardia is that diarrhea might come and go. A pet might have normal stool one day and not the next. This can make Giardia frustrating both to identify and manage. Giardia is important because it can cause an intestinal upset, especially in younger animals. Veterinarians interpret Giardia results along with the entire picture. Like, are they having diarrhea? How old are they? Are they having other health concerns? And are there other possible causes for why they're having diarrhea? A positive test result tells us that Giardia is present. It doesn't always mean that it's the problem. Another challenge with Giardia is that reinfection can occur. Treatment might eliminate the parasite from the pet, but if the environment remains contaminated, pets can still become exposed again. This is why cleaning and hygiene are important parts of managing Giardia. Picking up stool, washing bedding, cleaning contaminated areas, and following your veterinarian's recommendations can all help reduce the risk of reinfection. Giardia can infect people, but the types of Giardia that we commonly see in dogs and cats are not always the types that we commonly see in humans. The risk of transmission from pets to people is considered low, but good hygiene is still important. Simple steps like washing your hands after handling stool, cleaning up waste, and preventing pets from licking your face can help reduce the risk of reintroduction. The good news is that Giardia is a parasite that veterinarians are familiar with dealing with. With appropriate veterinary guidance, treatment when needed, and good hygiene practices, most pets do very well. Another reason veterinarians care so much about intestinal parasites is because some of them have the potential to affect people. This is called a zoonotic disease, which simply means that a disease or infection that can be shared between animals and people. Now, when many pet owners hear this, they immediately think, does this mean that my pet's going to make me sick? The answer is that some parasites can affect people, but it doesn't mean that pet owners should be afraid of their animals. Our pets provide tremendous benefits to our physical and emotional health, and the vast majority of everyday interactions we have with our pets are safe. The goal is not to avoid our pets. The goal is to understand that there are some risks and take simple steps to reduce them. Different intestinal parasites have different levels of concern when it comes to human health. For example, roundworms can be important because people can accidentally swallow microscopic eggs from contaminated environments. This is one reason that children are often considered at higher risk. Children naturally explore their environment, play on the ground, and may put their hands in their mouths more often. Hookworms are another example. As we discussed earlier, hookworm larvae can sometimes penetrate human skin. This is why avoiding contact with contaminated soils, wearing shoes in areas where animals may defecate, and good hygiene are all important. Tapeworms can also involve people in certain situations, although not commonly the flea tapeworm. The risk of infection is generally much lower when we practice good hygiene and maintain good parasite control. For Giardia, owners often have questions because it can affect both people and animals. However, the types of Giardia that we commonly find in dogs and cats are not always the same types that cause disease in humans, and transmission from pets to people is considered generally uncommon. The important takeaway is this: having a pet does not mean that your family is at constant risk from parasites. Good habits can go a long way. Wash your hands after handling waste, pick up stool promptly, avoid letting pets eat unknown animals' feces, keep living areas clean, maintain appropriate veterinary care and parasite prevention. These simple steps protect both your pets and your family. The most important thing I want owners to understand is this: finding a parasite does not mean you failed as an owner. Parasites exist in the environment, and exposure can happen even in pets that are loved, well cared for, and in clean homes. The goal of veterinary medicine is not to eliminate every possible exposure. That's impossible. The goal is to identify problems when they occur, treat them appropriately, and reduce the risk of future infections. That's why regular veterinary visits, parasite prevention, and testing when recommended are such important parts of keeping our pets healthy. Now, let's talk about what happens after a parasite is identified. How are intestinal parasites treated? So, if your pet is diagnosed with an intestinal parasite, what happens next? The first thing to understand is that treatment depends on which parasite is present. There is no single medication that treats every intestinal parasite. Roundworms, hookworms, whipworms, tapeworms, Coccidia, and Giardia are all different organisms, and they require different approaches. This is why identifying the parasite is so important. For some parasites, treatment might be a single course of medication. For others, repeat treatment or follow-up testing might be recommended. This is especially important because some parasites have life cycles that make them difficult to completely eliminate with one treatment. Another important thing to understand is that treating the pet is only part of the solution. Some parasites have life stages that survive in the environment. This means that cleaning and reducing exposure can be just as important as the medication itself. Depending on the parasite involved, your veterinarian may recommend things like picking up stool promptly, cleaning areas where pets spend time, washing bedding, preventing pets from drinking from contaminated water, reducing exposure to contaminated environments, and others. The specific recommendations depend on the parasite and your individual situation. Another major part of parasite control is prevention. Many pet owners think parasite prevention is only important after a pet has been diagnosed, but prevention is actually one of the best tools we have for reducing the risk of infection in the first place. Once you have things like roundworms, hookworms, and whipworms in your environment, you'll never get rid of them unless you're on consistent prevention, which makes being on it from the beginning a lot more helpful at stopping it. Preventative recommendations may vary depending on where you live, your pet's lifestyle, whether they spend time outdoors, exposure to other animals, their age and health status, and others. For example, a dog that spends a lot of time hiking, hunting, or visiting dog parks may have a different risk compared to an indoor cat. This is why parasite prevention is not one size fits all. Your veterinarian can help determine what prevention plan makes the most sense for your individual pet. One other important point. Please do not assume that over-the-counter products, home remedies, or internet recommendations are safe or effective. You also need to understand that diarrhea and stomach upset can come from a multitude of factors, so dewormers may not be treating the actual cause at all. The right treatment depends on knowing what parasite you're dealing with. Using the wrong medication may not solve the issue and could delay finding the actual cause of your pet's symptoms. The good news is that intestinal parasites are some of the most manageable problems that we see in veterinary medicine. With the right diagnosis, appropriate treatment, and a good prevention plan, most pets do very well. Now, let's clear up some common misconceptions about intestinal parasites. Only neglected pets get parasites. This is probably one of the biggest misconceptions about parasites. Many people assume that if a pet has worms or Giardia, it means they're unhealthy, poorly cared for, or living in poor conditions. But that's simply not true. Parasites are part of the environment. Even well cared for pets that live in loving homes can be exposed. A dog can pick up parasites on a walk. A cat can be exposed through insects or contaminated material brought into the home, like maybe on your shoes. A puppy or kitten can be born with certain parasites despite receiving excellent care. Having a parasite does not mean that someone is a bad pet owner. It means that your pet encountered an organism that exists in the world around us. If I don't see worms, my pet doesn't have parasites. This is another very common misunderstanding. Many intestinal parasites are microscopic and can't be seen by simply looking at your pet or looking at their stool. Some pets with parasites may show obvious signs. Others might look completely normal. That's why fecal testing is such an important tool. Veterinarians are often looking for microscopic evidence of parasites rather than waiting until an owner actually sees a worm. One deworming treatment fixes everything forever. This is another misconception I hear frequently. Many owners assume that if their pet receives a medication for worms, the problem's permanently solved. But parasite control is often a lot more complicated. Different parasites require different treatments. Some parasites have life cycles that require repeat treatments or ongoing prevention. Some can be picked up again from being in the environment, and some require addressing other issues like flea control with tapeworm infections. Treatment removes the current infection that your pet might be dealing with, but prevention helps reduce the chance of future infections. Scooting means my pet has worms. Scooting is one of the signs that causes many owners to immediately think about intestinal parasites, and sometimes it is the cause, especially when you've got tapeworm segments around the rear end. But scooting can happen for a lot of other reasons, including anal gland issues, allergies, skin irritation, or inflammation around the rear end. If your pet is scooting frequently, your veterinarian can help determine what is actually causing the problem. When it comes to parasites, the biggest takeaway is that understanding the problem is the first step towards solving it. Parasites are really common. They're not a reflection of how well you care for your pet. And with appropriate testing, treatment, and prevention, they're usually something that we can manage very successfully. So, let's bring everything together. Intestinal parasites are some of the most common problems that veterinarians see in dogs and cats. We talked about several of the parasites that pet owners are most likely to encounter: roundworms, hookworms, whipworms, tapeworms, Coccidia, and Giardia. And while each of these parasites are different, there are a few important things that they all have in common. First, it's that parasites are common. They are not a sign that you're a bad pet owner, and they're not limited to pets that are neglected or unhealthy. Even well-loved pets living in clean homes can get exposed. Second, parasites are not always obvious. Some pets may have diarrhea, weight loss, or other signs, but other pets might look completely normal. This is why routine veterinary care, fecal testing, and appropriate parasite prevention are so important in keeping our pets and ourselves healthy. Third, treatment depends on the parasite. There is no single medication that treats every intestinal parasite. The right approach depends on knowing what parasite is present, understanding your pet's situation, and working with your veterinarian to choose the appropriate plan. The good news is, intestinal parasites are some of the most manageable conditions that we see in veterinary medicine. With that proper testing, appropriate treatment, good hygiene, and prevention strategies, most pets do very well. If your pet has ongoing diarrhea, unexplained weight loss, vomiting, or scooting, then you might need to talk to your veterinarian about whether your pet has parasites. Your veterinarian can help determine what testing, treatment, and prevention plan makes the most sense for your individual pet. I hope this episode helped you understand intestinal parasites and why veterinarians take them so seriously. If you found this video helpful, please consider liking the video and subscribing to the channel. And if there's a topic that you would like me to cover in future episodes, leave it in the comments below. I'm Dr. Matt Clark. Thank you for joining me for Beyond the Vet Visit, and I'll see you next time. Go Pokes!